Dr. Alfano, I actually am a former foster parent and was blessed by her experience and wisdom and resources. So I come to this with an advocacy heart for healthy sleep for our foster and adoptive kids. And the tools that she gave us were a huge blessing at just the right time. So I'm excited to be a part of this. And as a representative of the Sanctuary Foster Care Services, we're glad to be able to offer this to foster adopt families and anyone else who wants to help learn about healthy sleep and help our children to find those better patterns for healthy sleep. I'll give an introduction for Dr. Alfano so you know a little bit about her and her background. She is professor of psychology, a licensed clinical psychologist, and director of the Sleep and Anxiety Center of Houston at the University of Houston. For over 17 years, her research, teaching, and clinical practice have been dedicated to exploring the many ways in which sleep during the childhood years directly impacts emotional and behavioral functioning across the life course. And we know this is so true. Dr. Alfano has published more than 150 scientific papers, chapters, and books on these topics, and has spoken across the globe on the importance of sleep for healthy childhood development. After becoming a foster parent herself in 2016, her attention shifted toward improving the sleep health of children in and adopted from foster care. Her research has shown poor sleep health to be pervasive and impairing among children who spend time in foster care. Her work has also demonstrated a general lack of sleep-based education, training, and resources for foster families, as well as child welfare professionals. We're going to take care of some of that today. With funding from the NIH and the University of Houston, Dr. Alfano is currently working with the Texas Department of Family and Protective Services to test sleep and adjustment in foster environments. It's called SAFE, the first trauma-informed behavioral sleep intervention for foster and adoptive families. And we're also excited to be a part of that with her. She's excited to tell you about this groundbreaking work today, and I'm sure give you some practical tools and understanding to help you and your own families today, or should I say tonight. So Dr. Alfano, I'll pass it on to you. I'm going to mute my video, but I'm going to be taking notes, watching the chat box, and I'll holler if there's something that I see as a problem.
Thank you so much, Jenny. That's a beautiful, perfect intro. So I'm speaking to you today, not just as a pediatric sleep expert, but as an adoptive foster parent. And as Jenny mentioned, this journey, I call it a journey because it's, as you know, that's really what being a foster parent is. It started for me when my little one arrived at the age of 1, and she didn't sleep. She didn't sleep for many weeks. And 2 things occurred to me at that time, or at least a little bit later when I caught up on my own sleep. The first one was that if I'm a pediatric sleep expert and I'm struggling with getting my daughter to sleep, what is the average foster parent doing? What are they dealing with? And secondly, I thought about all the training that I went through in the state of Texas, which is the case really across the US, related to caring for children in foster care. As you know, everything from brain development to nutrition to CPR. And I reflected on the fact that there was not one word uttered about sleep. And that really goes against everything that I know and that I've been studying for the past 17 years, which is that when sleep is a problem, something else, if not multiple other things, are going to be a problem. So with that, I want to start off today with some basics, because why are we even talking about sleep, right? There are so many things that we could focus on when it comes to children in foster care. They need support around so many different aspects of their life. But I want to just take a step back and think about the role that sleep plays in all of our lives. We spend 1/3 of our lives sleeping. That's 122 days a year, or if we're lucky enough to live a full life, it is 26 years of our life. More essentially than any other behavior that we do. And yet for most of us, sleep isn't something we really think much about, even though we spend all this time doing at it. Once upon a time, not that long ago, even scientists thought, well, sleep is just a time where we shut off and rest and nothing much happens. Nothing could be further from the truth. Our brains are as active during sleep as they are while we're awake. And there are certain essential processes that happen in the body only when we're sleeping. This is a very long list, and I'll just give you a few examples. Your blood pressure dips by at least, hopefully, 10% while you sleep in order to give your heart a break. And that dip is essential for protecting us from heart attack and stroke and cardiovascular disease. Toxins are cleared from the brain while we sleep. These are toxins that, if they are left to build up over time, they are associated with the development of various forms of dementia. Inflammation is reduced. Whoop, I was accidentally muted. Okay, I'm back. Which ward off various diseases. We also know that the body repairs itself during sleep. Muscle wear and tear and different injuries that might occur. These are all things that the body works to repair while we're sleeping. So if you think about it, much like breathing, sleep is a fundamental human requirement. In fact, we know from research in animals, you could go longer without food than you could without sleep. And I really like to think about it this way because it suddenly takes sleep as something we don't think much about, as something that hopefully is at the forefront of our attention. But sleep need changes dramatically across development. This is a graphic put out by the National Sleep Foundation based on a wealth of science telling us that this is how much sleep we need at different ages to function our best. And hopefully there are a couple of things that jump out at you right away. Let me orient you to some things. So these columns represent different stages of the lifespan, starting all the way from newborn, and we go all the way over to older adulthood. In the dark blue boxes are the general recommended amounts of sleep in a 24-hour period. So keep in mind for our little ones, this includes daytime napping. You also see these kind of teal boxes on either side of the dark blue boxes. And that is to reflect the fact that no two people are alike. We know that there are certain people in the population who need far less sleep than others, and there are people who need far more sleep than others. And so that's kind of what those teal boxes represent. But for the most part, where we want to be with our sleep is within these dark blue boxes. Now let's first look at sleep need during the first 2 years of life. So within this red box here, even up to the age of 2, children are spending 50% of their lives asleep, and in some cases more. And if we go a step further, and we look at the preschool years, so up until the age of 5, about the time children are entering school, again, almost half of the life, or our daily life, or their daily life, is spent sleeping. And then even to take this out a step further, let's look at our school-age kids and our teens. They need more sleep on average than adults. Adults, the recommendation is that we receive no less than 7 hours of sleep per night. What we know is that our school-age children and our teens on average need between 9 and 10 hours. I teach a class at the University of Houston to undergraduates all about sleep. And when I present this information to them, one of the things that I like to say to them or have them think about is that this doesn't necessarily make a lot of sense. Think about these little people who are coming into the world. They don't know anything about themselves, the world, how to move their body, how to speak a language. They're constantly learning from their environment. Wouldn't you think it would make more sense for them to spend more time awake rather than asleep, time where they could be exploring, observing, learning, mimicking from their environment? The answer is no. And the reason is that more than any other single activity, the brain needs sleep during the childhood years. This is especially true of the first 5 years of life, because in the first 5 years of life, 90% of brain growth happens. And that brain growth is associated with all different kinds of learning. This is a nice graph here to give you a sense what kind of skills are being mastered during the preschool years, 0 to 5, and then even later in the school age years. So we start with very basic skills, right? Like vision and hearing, um, and emotional control. But other skills that continue to develop that are critical are language development, understanding the behaviors and the expressions of others, how to interact with peers. And as children age, emotional control becomes even more important, right? They go to school, they have to be able to behave and control their behavior in different settings. And so the reason we now understand that the first 5 years of life in particular coincide with this increased need for sleep is very simply because sleep is the time when learning sticks. It's when all of the things that children experience during the day while they're awake essentially gets transformed into lasting memory and skill. So to go back to that question, wouldn't it be better for young children to spend more time awake learning? The answer is no. In fact, they're learning at such a rapid pace that they have to sleep more frequently to take that information that they've learned and consolidate it into long-term memory. Now, with that understanding, with that backdrop, what do you think happens when children don't receive the sleep they need early in life? There is a whole host of research telling us the same exact thing. When children sleep poorly, either because they're not given adequate opportunity to sleep, or because their sleep is disrupted, or because they have untreated or unaddressed sleep problems, they are much more likely to go on to develop more problems later in life. This includes physical health problems like obesity and diabetes, cardiovascular problems, other types of physical health issues, but also what we commonly see among children in foster care, which are more behavioral problems and disorders like ADHD, higher rates of anxiety and depression. They have more problems learning in school. Makes sense based on what we just talked about, right? You have to get adequate sleep to take what you're learning and consolidate it into lasting memory. Unfortunately, inadequate sleep is also associated with more serious outcomes like juvenile delinquency, incarceration later in life, attempted suicide, a really just very ugly list of correlates of poor sleep. That last item there isn't necessarily the worst item, right? Like attempted suicide obviously is going to be a much more grave result of inadequate sleep. But I put parenting stress here because we already know that foster parents are doing a job that is so incredibly important and that many people couldn't do because it's associated with needing to manage child behavior and different stressors and different challenges on a regular basis. But parents, just like kids, when they don't sleep well, in some cases because their child isn't sleeping well, are much more likely to be stressed. They're going to be less effective at parenting. They report greater rates of exhaustion, depression, anxiety, guilt, the whole gamut. And so inadequate sleep doesn't just affect our children, it affects us. And it affects us really profoundly, as many of you know. Okay, so let's talk about good news. That's bad news. Good news is that because early sleep patterns are in large part shaped by parents or caregivers, there are many things that parents can do to help their children sleep well. And let's think about how that happens. So, for example, for infants and children, parental presence at night provides a sense of safety and security. This might just be through rocking, cuddling, swaddling. For our older kids, this might mean dispelling, nighttime fears that there are monsters under the bed. For our older kids, it might mean just talking through the day with them and letting them know how loved they are. It's also important that we be there and we be responsive to their needs. So when our little ones get upset or they cry out, they feel secure in their knowledge that mom or dad will come. Somebody will respond to my cries for help. We also help them by providing appropriate schedules. Appropriate schedules allow for adequate sleep, but they also ensure that sleep is happening at the same time from day to day, because as we'll talk about, there's a little clock in our brain that regulates sleep, and it works best when we go to sleep and get up at the same times every day. We also provide consistent, comforting routines. I'm sure many, if not all of you, have a bedtime routine that you do with your little one. Children thrive on predictability and consistency. And so this is part of what helps them feel safe and secure for sleep. And then lastly, the environment is very predictable, right? They know where they're sleeping every night. They know what things are in their crib or in their bed. They know exactly what that interaction with their caregiver is going to be like before sleep. All of these things provide essential cues for sleeping well. Of course, we know that not every child starts out in life with this scenario. Our children who come into foster care because fundamentally they are not safe. And that leads to feelings of fearfulness that are counterproductive for sleep. In many cases, they also have caregivers that are either not present or they are present and they're non-responsive. Or when they do respond, they don't respond in a consistent manner. And so children don't feel secure in the knowledge that if I need help or if I cry out, mom or dad will be there to help. Sleep schedules for children who are removed from an unsafe environment are often revolve around what's convenient for someone else. If parents work at night, children might be awake at night. If parents are sleeping all day because they were out all night, children might be sleeping all day. So that consistency factor, unfortunately, is not present. And then, of course, we know the environments in which these children are reared are anything but predictable. In some cases, there's housing instability, there's food insecurity, there are all kinds of different forms of violence potentially in the home or in the surrounding neighborhood that make the sleep environment not feel safe. All of that happens before children are removed and put into the care of somebody they don't know. And while we as foster parents take some comfort in knowing that this child is now in a safe environment, the reality is they don't know it's safe. All they know is that it's different and you're different and everything is different. And everything they've experienced previously is unpredictable, inconsistent, and not safe. And they can't just shake that when they get placed into an environment that is this loving and nurturing and safe. And so that kind of leads us to what we know about the relationship between childhood maltreatment or trauma more broadly and sleep. Sleep disturbance is one of the most common and enduring consequences of early maltreatment and trauma. There are now numerous long-term studies that have followed individuals into adulthood. And what they find is that long after a child has left an abusive or neglectful or unsafe environment, they continue to have sleep difficulties well into adulthood in many cases. Why exactly? Why does that happen? It's because trauma sends the central nervous system essentially into high alert mode. It's a state of persistent arousal. It's adaptive if you think about it, right? It's preparing the individual for the possibility of future threat. And what happens is the slightest hint of danger or uncertainty, and that high alert mode kicks in, as we know. And for children, it's a normal developmental phase in many cases to be afraid at night. It's dark, you're away from caregivers, there are strange noises. But when you couple that with a history of trauma and uncertainty and inconsistency, what you get is hyperarousal that doesn't decrease just because it's time for sleep. And that's the problem, that sleep and anxiety are opposing processes. You can't be asleep and highly anxious at the same time, at least not for long. And so, unfortunately, we see that many children in foster care have problems falling asleep. Others fall asleep just fine, but they wake up multiple times a night. They have nightmares, they have night terrors, they're seeking out the parent, they wake up too early and can't get back to sleep. All of these are just different manifestations of the same underlying issue. It's a central nervous system that's kicked into high gear. So sleep is a problem for many children in foster care, but what I think gets neglected is the fact that a very vicious cycle develops because poor sleep, as we just learned on the previous slide, increases daytime behavior problems. If you think about yourself, after you've had a night of poor sleep, you're not very patient. You don't do a great job at regulating your emotions. Small little things annoy you. Well, imagine now if you're a child who doesn't have the benefit of all of those years of practice. And on top of that, they have this history of maltreatment, right? What that means is a little bit of sleep loss is going to produce more problems regulating behavior during the day. And then, of course, when a child is hyper aroused, that feeds in to more sleep problems at night. So this very vicious cycle can develop and can be very, very difficult for foster families to find their way out of. What's amazing to me as somebody who studied sleep for so long in children is that until recently, we didn't really know very much about the sleep of children in foster care. Sure, anecdotally, we would hear foster parents telling us all the time, sleep is a problem, sleep is a problem. But research is important because systematic studies tell us exactly how prevalent are these problems and what are families dealing with. So a couple of years ago, my team at the University of Houston conducted what is the largest survey of foster parents across the United States. Almost 500 parents filled out a detailed survey, and they told us about the sleep of just one child in their care, currently in their care at the time they completed the survey. Children had to be between the ages of 4 and 11, but they could have been in foster care anywhere from one day to all of their lives. And we discovered a few things that were really quite telling. The first thing was we asked them, what was the quality of the child's sleep? Quality meaning like overall, how restful was their sleep? How consolidated was it? How, consistent? And what we learned was that when children first arrived in the home, much like what I experienced with my daughter, sleep was pretty poor across the board on a scale of 0 to 10 from worst to best. The average fell somewhere around 3, which is terribly poor. We then asked parents, how is the sleep of this child now? And just to let you know, on average, these kids had been in the home for 16 months. So they weren't just in the house for a few weeks. These were kids who were settled. Sleep quality improved, but by no means to where we would hope. It was still only at about the middle of the range on average. This is not what we would consider good quality sleep. And then our analyses that we did with this data told us that when parents reported that the child had very poor sleep quality when they arrived in the home, these were the kids who 16 months later were much more likely to be anxious and to be depressed, just like we know often happens. What kinds of sleep problems were the children experiencing? We asked a whole range of different problems, and these are some of the most common problems, and these problems were endorsed as occurring either sometimes or usually. 86% of kids went to someone else's bed or tried to go to someone else's bed during the night, or they sought out a caregiver more than half the time. Nightmares were very common, sleep terrors, and I'm happy to talk about the difference between those two if there are questions, because they're not the same thing. Bedwetting, teeth grinding, a whole bunch of problems. If you compare these percentages to the rates of these problems in the general population of children, these are staggering rates of sleep problems that suggest we need to be intervening around sleep. A couple of other tidbits that we found that were really important. The more time children were in foster care, the worse their sleep became. Somewhat counterintuitive, right? Shouldn't their sleep be getting better? The answer is no, not if they don't have the skills to improve their sleep, which we'll also talk about in a minute. It also didn't matter how old the child was. It didn't matter if they had their own room. It didn't matter how long they were in the home. These problems were just as prevalent among children. And so for us, what this means is the bottom line: sleep problems don't necessarily improve over time on their own, which is a common misperception, I think, among foster care agencies and child welfare professionals. And they lead to other problems. The last slide I'll show you that presents information from our survey. We also asked foster parents, what are you doing about these sleep problems? What support are you getting? Very few parents told us they get support from their foster care agency around sleep, other than maybe an informal discussion here or there. More than half of the sample, 55%, said we've talked to our pediatrician or healthcare provider to try to get help. However, in most cases, what they got was a prescription for a medication, or they were told to buy melatonin. And I'm going to talk about melatonin on the next slide because it's an important topic. It's also important for me to point out that these were 4-year-old children getting prescribed heavy-duty antipsychotic, mood stabilizer, antidepressant medications. There are no FDA-approved medications for sleep in children. That's a fact. So all of these things are being prescribed off-label, and we don't really know how well they work, and we don't know how safe they are. Contrast what recommendations foster care givers were being given with what they were telling us was the most important thing to help their children sleep well. These were open-ended. We gave them a checklist of things, but they were also open-ended boxes. And the most common strategy was a consistent bedtime routine, followed by providing reassurance of safety and love at night, making sure the environment in which children sleep is calm, ensuring they get good physical activity during the day, and then also ensuring there is wind down time before bed. So there is this real mismatch between what foster parents are being provided and what their own observations are telling them is helpful. I had said I would spend a little time on melatonin, and I want to do that because the other thing we learned in our survey was that almost half of the sample reported giving their child melatonin, either because a pediatrician recommended it or because they just thought it might be helpful. Although half of the sample was giving their children melatonin, of those, only 59%, a little more than half, felt that it actually helped their child, or really just weren't sure. So they were giving it because somebody told them to give it, but they really didn't see a difference. So they just kept giving it. And then concerningly, many parents told us, and I'd be curious if anybody has comments about this, that melatonin gave their child nightmares or night terrors. And so they had to stop giving it. And that's consistent, by the way, with what we know melatonin does, which is makes dreams very, very vivid. So what is melatonin? It's all over the place. You see it in gummies, you see it in, liquid form, you see it in pills, you see it in tablets, and it's got these really child-friendly labels in many cases, which I think has contributed to the notion that it's extremely safe. First of all, what is melatonin? It's not a drug, which is why you can get it over the counter. Although the US is one of the only countries where you can get melatonin over the counter. Across the globe, you need a prescription. And I'll talk about why that is in a second, but it's not a drug, it's a hormone. And specifically, it's a hormone that's called a chronobiotic. What it does is, it doesn't have sedating effects. It doesn't make you sleepy. But what it does is it works with the body's natural production of melatonin, because we produce melatonin. So all taking melatonin does is it kind of boosts our normal melatonin levels. And it provides this kind of internal cue to that brain clock I was talking about that, hey, it's time to sleep. But what that means is that you have to take it at the right time. If you don't take it at the right time, it actually can make sleep worse. And so, what we want to be giving, what we think is appropriate for children, is 1 to 3 milligrams at least 60 minutes before sleep. It's not sedating, so you don't take it at sleep time like Benadryl or some of these other medications. And then the other thing is, I see dosages for children sometimes upwards of 10 milligrams. That is way too much for children. Remember, this is a hormone, and children are still developing. We don't know what the effects are of 10 milligrams of that hormone are on the body. So you want to stick to 1 to 3 milligrams in most cases, and at least 60 minutes before bedtime. I also want to point out that even though you can get it over the counter, it's not necessarily safe. There was a shocking, I want to call it, report that was put out by the Centers for Disease Control last year that basically found a 520% increase in the use of melatonin among children in the past 10 years. And part of that is attributable to this beautiful packaging that's out there, and it's all over the shelves, making it seem like it's very safe and that it's very effective. The reality is there is no effectiveness or safety information about melatonin in children who've experienced maltreatment or trauma. So parents who find that, hey, we had to stop giving it because it made nightmares worse, or it actually made her wake up in the middle of the night, we don't have a lot of information about this, but this could be happening for many, many children. The other thing that the CDC report pointed out was that there was an increase in the number of calls to poison control centers associated with melatonin use. These are gummies, right? Children think gummies are candy. And so this needs to be kept away from children because it is possible to overdose. And there were cases where children became very, very ill from taking too much melatonin. There were even a few cases of death. So just a safety note about melatonin. Yes, you can get it over the counter. Yes, it comes in gummy form, but you want to make sure children don't have access to melatonin other than when it's given to them, and it needs to be given to them in the right dose and at the right time. Okay, now on to some good news. How can we help the children in our care get better sleep? The good news is that sleep is a behavior. Remember, it's the behavior we do more than any other. Any behavior can be learned. Behaviors can also be unlearned, which is what has happened for many children in foster care. So how can we help children get better sleep? The first thing we need to do is create a calm environment. Sleep can't happen when there isn't calm inside the body, but also outside the body. So we want to think about making sure the evening environment in our home is one where conflict is kept low, activities are kept calm, lights are kept dim. We want to be sure to follow a consistent and soothing bedtime routine, because bedtime is a struggle for many kids. Unfortunately, it also means that it creates conflict and fighting and arousal and frustration. We want to do our best as parents and the leaders of the ship. We want to do our best to keep things calm, consistent. Provide rewards for getting jammies on. Don't make it a struggle. Make it a checklist, make it a game, make it a reward. But everything that happens leading up to bed sets the emotional tone for sleep. So we want to really go out of our way to avoid conflict and avoid meltdowns as much as we can. We also want to help children develop their own sleep cues. If you think about it, there are things you do every night, either before you get into bed or when you get into bed, that help you sleep. Maybe it's rubbing your feet together. Maybe it's having the pillow over your face. Maybe it's one leg hanging out of the covers. You might not pay much attention to it, but these are things that you've used over time to help your brain know, hey, it's time to sleep. For children who've been reared in the presence of inconsistency, unfortunately, they haven't developed these cues. You can help them develop these cues. Pay attention to what position they fall asleep in and remind them that that's the position they sleep best in and that they should get into that position when they get into bed at night. Come up with your own routines and things that you do that are soothing, that help children know it's time for sleep. These shouldn't be elaborate things. These are just kind of simple things you do right before bed that provide a cue. Remain calm and emotionally supportive. Kids need our help at bedtime. All kids do. It's a normal part of development to have fears of monsters under the bed, and it's dark and there are shadows. These fears, of course, are multiplied for children who come from early adversity. So be a calm presence, be emotionally supportive. We want to help our children to learn to sleep independently, but we also want to do it in a way that's supportive. And so if they're struggling, come back and check on them every few minutes rather than lying in bed with them. Lying in bed with them will be comforting, but it doesn't help them learn those sleep cues that they have to learn on their own. So instead, tell them that as long as they're in bed and quiet, you'll come back every few minutes and you'll check on them. And then, of course, sleep should be in the same place every night. There's lots of kids who move around and they sleep in different beds or they fall asleep on the sofa. Our bed should be the strongest of all cues for sleep. We get into bed at night, hopefully we feel calm, we feel relaxed. But if we're sleeping in different places, our bed never becomes that cue. And so we really want to try to help children to sleep in the same place every night. These simple strategies will be effective for a lot of children. Unfortunately, there are other children who have much more difficulty, and parents need to be more supportive or more present, or they need the help of an outside source to help children sleep. And it's for these families that we've developed the intervention that Jenny mentioned earlier, which is called SAFE, Sleep and Adjustment in Foster Environments. This is our website here that you're welcome to visit, safeintervention.com. Basically, it is a very brief but trauma-informed behavioral sleep intervention for both foster parents and adoptive foster parents to meet the unique needs of these children. A little bit about SAFE. We have two different programs that are happening right now that are available. One is for children ages 6 to 10 who are in foster or kinship care or who've been adopted from care. This project, as Jenny mentioned, is funded by the National Institutes of Health, that's the federal government, because they recognize the need for this type of program. It's been approved by the Texas Department of Family and Protective Services, who I work with very closely. And very simply, it's based on those TBRI principles that you learned when you went through your training to become a foster parent. It integrates those principles with gold standard pediatric sleep interventions, which is what I've been studying for the last 17 years. For this intervention, the caregiver and the child meet together with a sleep expert via Zoom for 4 sessions. They're usually spread out about 1 week apart. They're about 50 minutes each, but both the caregiver and the child learn about healthy sleep. They learn about why sleep is so important. We try to change the whole discussion about sleep to make it a positive thing rather than a negative thing, which it is for many children. So it's very child-friendly. There's a child workbook, there's exercises, there's games involved. And the best part, not the best part, but a good part, is that because it's funded by the federal government and families are helping us learn about how effective this intervention is, families who participate are actually compensated for their time, up to $150. We also have Safe Tea, and this is our safe intervention for toddlers and preschoolers. So it's the same concept. It's for foster, kinship, and adoptive families with children between the ages of 2 and 5 years. Again, it's delivered via telehealth. For these sessions, we only meet with the caregiver. We don't expect these little ones to sit on Zoom with us, but it's 3 sessions with a sleep expert where we focus on your particular child, because no 2 children are the same, to develop strategies to help them get better sleep. And again, families are compensated for participating in safe tea. I want to just briefly show you, because we need to leave some time for questions. I want to briefly show you what our outcomes are so far, because I think that they're so exciting. This is a study where we compared safety to SES, which stands for Sleep Education Support. For the SES group, we simply mailed them a booklet about sleep. It had a lot of great information in it, but they didn't work one-on-one with a sleep expert. What we found was an average increase of 40 minutes more sleep per day in our safe tea group, compared to a decrease in sleep in the SES group. 40 minutes a day. Multiply that by 7 days a week and think about how much more sleep that is that these kids are getting. And it also explains why we're seeing a similar outcome in terms of child behavior problems. So the kids who are participating in safe tea are not only sleeping more, but that sleeping more coincides with a major decrease in daytime behavior problems, which we're not seeing in the other control group I told you about. So really exciting. It's also what parents are telling us, that really tells us that this is work that probably needs to be made available nationally to all foster parents. So her daytime behavior is so much better. CPS needs to make this required training. All of these quotes make me so happy to hear that families' lives are being improved. Both interventions are available, one for 6 to 10, one for 2 to 5-year-olds. If you're interested, please send me an email at safesleepintervention@gmail.com. You can also call me if you want to take a screenshot of this with your computer. I'll leave it up for a second. You can also find information at my website, which is at the University of Houston. Lastly, I want to just leave you with a couple of resources that are available online that I think are some of the best resources out there. So the first is the Pediatric Sleep Council website. The Pediatric Sleep Council is made up by sleep experts across the globe. These are the people who've written the book, who've done the research. It's called babysleep.com. It really deals with under age 5 sleep, but there are tremendous resources here for just about every sleep problem you're dealing with. You can also, for older children, the Sleep Foundation website has wonderful resources available. There's Sleep for Kids, which is a great website made available by the National Sleep Foundation. There are fun activities for kids here to get them thinking about sleep in a different way, get them understanding that great things happen when they go to bed at night. They grow, they learn, they get smarter, they get stronger. And then lastly, a book by my colleague, Jody Mindell, which I think is really an excellent resource, Sleeping Through the Night, How Infants, Toddlers, and Their Parents Can Get a Good Night's Sleep. There are wonderful tips here for all parents. Okay, I think I am going to leave it there. And why don't we open it up for questions? Because I'm going to stop sharing my screen here.
That was amazing. And those outcomes are phenomenal. 40 minutes of sleep.
It's a lot of sleep. It's a lot of sleep, because again, multiply by 7. Think about yourself if you got 40 minutes more a night. How amazing that would be.
Amazing. Well, we have some good questions here. A couple people asked about sound machines, those noise machines that help with sleep, supposedly. Tell us what you recommend.
Great question. What we're hoping to do is 2 things with those machines. One is block out extraneous noise, that if you are very aroused, like many of our kids are at bedtime, you're attuned to different noises and what was that and what does it mean? So they have the benefit of drowning out those kind of outside noises. But the other benefit is it's a sleep cue. In full disclosure, my daughter has been sleeping with crickets in her room. I often joke she's going to get married and she'll need crickets to sleep. But she's been sleeping with them since she arrived. And boy, is it a cue for her. We turn on those crickets and it's like the brain goes into sleep mode. So I think noise machines are wonderful, whether you want to just use plain white noise to block out extraneous sounds, or whether you want to use something very calming. I don't recommend background noise from TVs or music because the brain has this tendency to want to follow. So if you can stick to something, like rain outside or crickets or, a babbling brook, I think that's wonderful.
That's amazing. Yeah, your comment about trauma sends the central nervous system into a state of persistent high alert. That stood out to me, and we experienced that with our own foster 4-year-old. Yeah, the body's response. Okay, the next question, another good one. We've had the best success with our 10-year-old on a pallet in the living room. I would like to help her now move from the public space to her bed. How can we make that transition?
Good question. It'd be easier if I knew her history and why you all started, using a pallet in the living room. But what I would recommend is if you could, first of all, that mattress is a cue, right? We all know our own mattress. So if it is possible to take whatever mattress she's sleeping on and bring that to the room, so you're not changing everything all at once. Are there other things in the room that you could bring to the bedroom to, again, try to replicate that environment? As many cues as you can keep consistent, the better. And then she might just need a little bit more support when she makes that transition. So I mentioned, I think, about doing the check-in method. I really like that because it's encouraging children to develop their own self-regulatory skills around sleep, but it also provides that scaffolding. I'll be back in a few minutes. You're doing great. Keep it up. So I would use the mattress. Maybe that's not the ultimate goal. Maybe you want to get her in a regular bed, but to start, I would use the mattress so that that's consistent. Keep the bedding the same, if you can keep the noises, the amount of light the same, and then provide that emotional scaffolding with doing some check-ins and keeping everything calm around bedtime so that you're keeping that arousal level at bay as much as possible.
And I'm curious, you mentioned the difference between nightmares and sleep terrors.
Yeah,
Can you
good
talk about
question.
that?
They can look the same. They are so very different. Night terrors are something called a parasomnia. That happens in the deepest stage of sleep. So night terrors will reliably happen within the first 3 hours after bedtime. That is when children are in the deepest stage of sleep. Other than if they're in a night terror or parasomnia, they're very hard to wake. That's when they get that most restorative sleep they need. For certain children who have struggle sleeping, what happens is they're sleep deprived when they fall asleep. They're sleep deprived because it took them too long to fall asleep, or because they're carrying what we call a sleep debt. They didn't get the sleep they needed last night or the night before that. When children are sleep deprived, they go into that stage of deep sleep rapidly because they're so tired. But that rapid transition can lead to parasomnias, where essentially what's happening is one part of the brain is waking up and the other is staying fast asleep. And so although a child might sit up in bed and their eyes are open and they seem to be looking at you and they're screaming bloody murder, they're actually fast asleep. The good news is they're not harmful, and the child won't remember them the next day. If you say, hey, what was that? They'll have no idea what you're talking about. The bad news is they're disruptive for parents. If they go on for a long time, they also disrupt the child's sleep. So the treatment for night terrors is more sleep, ironically. Nightmares are different. Nightmares happen in the second half of the night. They happen in rapid eye movement sleep, which is the lightest stage of sleep. It's why when you wake up first thing in the morning, you kind of go, oh, what was I just dreaming about? And it's very vivid. And then, of course, it rapidly goes away. But it's because you're just coming out of REM sleep. If a child wakes from a nightmare, unlike a night terror, they're awake. And they will remember it the next day. Nightmares can also be disruptive too, because if children have them enough, they're afraid to fall asleep. They're afraid they're going to have more. The other thing is that nightmares can happen multiple times a night. Night terrors can happen multiple times a night too. Usually they don't. But nightmares, because kids remember them, they can be afraid then to go to sleep the next night or the next night. And they get treated in a different way. Nightmares are not necessarily a sign of sleep deprivation. They actually respond to a certain kind of treatment where we work with children to essentially rescript their dreams. They have to practice a new dream, a calming, comforting, positive dream where they're in control and only good things happen. We write it with the children. If it's a young child who can't write, we just kind of draw pictures and practice it. And we practice it every night before bed. And it can actually change what children dream about, which is really cool.
That's a lot of what we do at the sanctuary, retraining the brain and
Yep.
healing those brains. It's amazing what brain science has taught us in the last 20 years, what they've learned, and just much like what your research on sleep is showing us, that we
Yep.
can retrain those patterns of thinking. Amazing.
Yeah. Yeah.
Amazing. Back to melatonin. Someone asked about there's a recommendation for taking melatonin breaks to support developing sleep cues. What do you say
Mm.
about that?
I'm kind of hearing a few questions embedded in that question, and I'm actually really glad that somebody brought this up because that's the other thing I didn't mention about melatonin. When you have to take a pill every night to sleep, whether it's a drug or melatonin, um, the other risk is that you no longer feel in control of your own sleep. You feel that unless I take this pill,
Mhm.
I'm not going to be able to sleep. And we know placebo effects are very powerful, right? Even children experience them, and they can experience them for melatonin. So that's my other fear with regularly using melatonin among children. It in many ways sends the wrong message about sleep. If it's helpful and you're only taking 1 to 3 milligrams and you're taking it at the right time, I don't think you should stop. I think you continue using what works. But if you want to come off of melatonin, what you can do is, if you're at 3 milligrams, go to two, or if you're at 1 milligram, go to a half. And it's easier to do that with things like liquid and gummies, but you can kind of gradually take it away, and then educate the child that you don't even need this anymore. You've learned great sleep habits. You're doing this all on your own. So it's also about building confidence, their confidence around sleep, that it doesn't have to be scary. I like to say to kids, you can be the boss of your own sleep. You can be in charge of when you sleep. In terms of breaks, you can take breaks. There's really no good research to suggest from a physical standpoint whether that is healthier or not. But I do think it's a good idea periodically to say, hey, is this even helping? Let's not give it one night and see what happens. Um, but then you've also got to decide, is this a placebo effect?
Mhm.
Or is it the actual effect of the melatonin? So it's hard to give a straight answer because every child is different. I think you've got to figure out what works for your child.
Mhm. Someone else said this webinar is so very helpful. One more question from her. Do you have tips for overnight potty training? We're currently waking our 4-year-old once overnight to use the bathroom.
Um, so that's a good question. Really, boys and girls develop, by the way, this skill differently. Girls usually can stay dry overnight sooner. The girls can stay dry overnight sooner than boys. So keep that in mind. But even for girls, it's not uncommon, irrespective of their history, that they just can't stay dry through the night before the age of 5, or in some cases 6. So if you feel as though it's helping your child, um, continue with it. But we also don't want to assume that a child can do something before they are physically able to do it. So a pull up is fine at night, um, because for many 4-year-olds, they don't have the size bladder to go all night without excreting. But then it's also just control of muscles. So I think that again, it depends on the child, but it's probably unlikely to think that most 4-year-olds can go every night without wetting. Um, this is the age where it's very variable. Some kids can do it, and so that may kind of create the expectation, well, then why can't my other kid do it? But every child is different. So keep at it if you think that waking the child to use the potty is helping them learn bladder control, but don't get frustrated if it doesn't seem to be sticking, because at 4, it's highly variable whether a child can go the night without needing to pee.
So is it helpful to wake them up, you think?
Um,
Or should we let them
Sometimes
sleep?
it's just hard to know. It's always going to be helpful in that, sure, if you wake them up and take them to the bathroom, they're going to go. But it's hard to know if you're actually, I mean, you're trying to train the brain essentially to recognize those signals of I have to pee. So it can be helpful. But what I would just say is that there are legitimately 4-year-olds who just they can't do it. They sleep too soundly. They just don't have the bladder control yet. So if it seems like it's helping your 4-year-old, absolutely stick with it. If it seems like you wake them up to pee and then an hour later they wet, maybe they're just not ready yet to be woken up in the middle of the night.
Mm-hmm. So there are a couple more questions. Do we have time maybe for one more?
I do, yeah.
Okay, one more here. Our 4-year-old sleeps on a pallet next to our bed, wakes up every night around 2 or 3, and doesn't go back to bed unless she's in our bed. We are exhausted. Will good routines help her stay on her pallet all night? So this kind of encompasses, I mean, I think everything you've said. This is one of those situations that they
Yeah.
need sleep.
Yeah, and these are the kiddos oftentimes that come into our sleep intervention because it's hard. It's admittedly hard, and I feel for you with the exhaustion. I know how that goes, because in the middle of the night, your brain might tell you this isn't the right thing to do, but you're really tired. So you say, okay, just get in bed with me. The answer to this one is a little bit longer. And again, if you want to contact me about our sleep intervention for 2 to 5-year-olds, I'd be happy to tell you about it, because usually this takes a little bit more time to essentially retrain the child to develop self-regulatory skills. A lot of it is the parent has to kind of have the wherewithal in the middle of the night to say, no, you have to stay in your own bed. Mommy and daddy are right here. So again, there's scaffolding and support and reinforcement. But if something is available to a child in the middle of the night that they really want, they're going to keep waking up for it. That's kind of the way our brains work. So if the behavior is being reinforced, it's not going to go away. So I'd be happy to work with you if you to this parent, if you want to send me an email. Can everybody see the chat, Jenny?
I think so, yes.
Okay, let me just put my email in here one more time.
Yes, put your email there, and then we will send an email follow-up. It may not be till next week, but we'll send an email follow-up with, I would love for everyone to have the connection, make sure they know how to find you on your website and for your interventions if they want to be a part of those. How long will those continue?
The one for 6 to 10-year-olds, we're only in our first year, so that's going to be going on for another 2 years. The one for 2 to 5-year-olds is probably only going to be going on because we've hit our numbers, and now we want to publish the findings so that we can get more funding to continue it. But that one's probably only going to be going on for another 2 months or so.
Okay, good to know. So yes, we will send a follow-up email to all those who have registered, along with the link, hopefully, for watching for those who didn't get to hop on today. I just remember when our therapist with the sanctuary called you and we had a conversation, the three of us. You gave us 5 or 6 ideas, many of the things you mentioned here today about consistency and routines, countless ideas, what to do with the melatonin, our schedule, how to respond to her in the day as well as the night. And I think I put into practice just 2 or 3 of them to start. And we finally started getting sleep. So your tools
So
and
glad to hear
resources,
that.
oh, it was amazing. And so I hope everyone is going to reach out if they need to connect with you further after this, and either be a part of your study, you looking at the resources that you can provide. You definitely know and have the information. So I know I see a lot of thank yous popping up.
My pleasure.
Here.
And if you know another foster family that would benefit from this webinar, or who would benefit from from the sleep interventions that we're offering, please let them know. We're available for families throughout Texas, which is really exciting. That's the beauty of doing this via telehealth. You don't need to be in Houston. And hopefully at some point we will take this much broader than Texas, because it's greatly needed.
It is greatly needed. And as a foster family, we thank you for all the foster families and adoptive families that you're recognizing this need is a huge blessing to us, because we need all the help. So thank you so much, Dr.
My
Alfano, and to
pleasure.
all of you who were here. Yes, more thank yous coming in. So thank you so much. I hope you all enjoy this beautiful day and this weekend.
My pleasure. And thank you all for what you do.
Take care. Bye-bye.
Bye now.